Millions of Americans pay health insurance premiums, contribute to a retirement plan, and pay union membership dues using payroll deductions. And it is not right that CMS is attempting to weaponize Medicaid to break down the rights of workers and the fabric of unions and organized labor in this country. All workers should have the right to collectively bargain for better pay and for better working conditions. And this rule and this amendment undermines that right in a profound way. And I want to speak just very briefly from personal experience, having hired many home care workers for my own parents. As my mom suffered Alzheimer's, my dad had a stroke. In one under 2-year period, we went through 23 different home care workers. And I got to know these people and the struggles. And my parents weren't easy to care for, but I could not have done my job. My husband and I could not have raised our boys without their help. And they need our help. And when rules like this come into place, when, as my colleague Barbara Lee said, this is such a field dominated by low-income women of color. We have to make sure that we are protecting them because it does affect our seniors and those with disabilities and the quality of life. In the midst of a dramatic workforce shortage with turnover rates as high as 60%, this rule is going to make it even more difficult for seniors and people to find and keep consistent quality care that lets them live at home with the dignity they want and they deserve. Given this demand, we should be finding ways to strengthen this critical workforce. It's about time we give the women of color that dominate this workforce the respect they deserve. And I yield back.